Thank you very much for the invitation to your great meeting. I want to start, I think this is a very neglected area when we're rejuvenating the face. We started with the mid-cheek. We've been talking the last 2-3 years about the lower face. So I think it's about time we start talking about the upper third of the face. And I think it's a very important aspect when we look at a face to know about the age of a patient. And one of the things we've been talking about temples now for a few years, but a couple of areas that we kind of have neglected is really the forehead area. And if you look at patients as they age, you're going to start to see that they start getting depressions in this area. And if you can bring that area up, it gives a much nicer and softer and a younger look to the face. And also, I think that somehow we may be actually doing this iatrogenically as well with Botox. I think that some of my patients that I've been following for years, that I've been putting a lot of Botox around the eye area, you can see that they have atrophy in this area. And I suspect that we may be doing a little bit up in here because the muscle is going to be giving some sort of volume to that area. So we have a kind of a short period of time. So what I'm going to do, I'm going to start by first injecting her eyebrows and show you the technique that I use. And what I'm using here is called the TSCL pen, and it's basically an instrument that allows me to be focused more on my injection than on my hand that's injecting. It allows you to basically, there's several areas that you can push on. You can see that I can drop down the material here. You can have it either going as a drop or you can have a continuous flow. So what I like to do is, if you go and look at fashion models, fashion magazines, you're going to see that the models often have a very nice little light reflex that is usually present here in the lateral part of the brow. And you can see that our patient here is sort of lost that. You can see it over here, but on the lateral part here, we've lost that lift. So what I'm going to show you is what I do. It's very simple. I put my finger here just to kind of and I'm going to go deep. I'm going to slide my needle in, down. I'm going to go along the bone, and then I'm going to inject as I come out. So I'm just injecting slowly. So what I'm going to do, I've moved up a little bit more medially. So because I'm right-handed, I start on the lateral portion of the brow, and so I've moved my needle up a little bit. I'm going to inject. So you can I keep my fingers here to control the material, and you can hear the sound of the material coming out there.
In this submuscular plane, you see the eyebrow, the fat, the muscle, and in the submuscular plane.
Okay, Wayne,
okay.
You can go.
All right, I'm going to inject again here. Now, just one important caveat that you have to remember is that you have to look at the patient. If they're very hollow in this area here, you have to be prepared to inject material up in here to soften this area here. So I think I've basically got about 3 minutes per each area. So I'm going to move on now to the. I think what we'll do is the temple area. So Philippe, okay, on va tourner la tête. So I'm going to show you the technique that I use. And the technique that I use is I try and look for the deepest area of the depression here. And what I like to do is I use a 30-gauge needle, and I go straight in. So this needle is approximately 1 centimeter, so I'm going to be I'm going to be within the muscle. And if you happen to see that there is a blood vessel where you want to inject, then what you can do is pull the skin and pull the vessel over and enter into the particular area that you wish.
When you mentioned the needle size, you mentioned the automatic injector.
Yes.
And you are using the Tioxan range product, but which one and how do you decide?
Okay, I'm using Global Action. I like Global Action for this particular area here because it's soft and a little bit more mobile. And the other trick or tip I might suggest is, rather than trying to mold things with your finger, you can use a Q-tip to just gently mold the area. And so typically what I'm going to do, Marina, is I'm going to inject from the lateral point, and I'm going to go up to midline, and I stop here, and then I would start over here on the other side, and then I work down this way because I'm right-handed.
Yeah, usually this area does not require a lot of the product. Never over-inject.
Very little stuff.
Yes.
So I'm injecting here, Global Action, I'm probably putting in 0.2 cc's per side.
Good.
Okay? When you get to the temple area, however, it's a different story. You can easily drop in 1 to 1.5 cc's per site. So I'm going to go in here. So I've marked here for you to see this is where I see as the maximum area of depression. I'll try and keep my hand. Normally I would go straight in, but just so we can see what we're doing here. So what we want to do is we want to take the needle and we just plunge right in.
Same plane than Wayne. I crossed all the soft tissue. I crossed the skin. I crossed the fascia. I crossed the aponeurosis of the temporalis muscle. And then I'm in the temporalis muscle. You see my needle here in the temporalis muscle near the periosteum. So
okay, so this is a safe plane for needle.
The muscle is stitched to the bone, and the product will stay in the good place, and there's no risk in this area.
Okay, thank you.
So the third area that I want, the density too. The third area that I want to just address quickly for you is the frontal area. And what you have to do is you need to look at patients and look for the depression. And in this area here, we have a depression here. And so what I'm going to do is I'm going to actually lift up the forehead. Can we see that? Are we in a good... Benjamin,
yes, we can.
You see? Okay, so yes. I'm going to inject up. I'm going to put my needle deep to there, and I'm going to fill up that area here.
So are you deep? We didn't get it.
I'm in the subgallio plane here.
Yes, now it's good.
Okay.
So stay like that, and we are going to ask Philippe to show exactly where you are.
Okay.
Philippe, could you comment?
I think that he's in here
yes,
in
good,
the
very
subcutaneous plane.
Okay. Okay, so I think it's very demonstrative and very good. So could you make your conclusion, Wayne?
Okay. So again, I think this is a very important area that we need to start looking at for fillers. I put in usually about 1 cc to 1.5 cc's per side, and you need to have a very soft flowing material that you can mold afterwards. You do not want to use a very highly G' product.
And you use the dosing system, actually, the injector, which actually allows you to dose your filler, which is important in this area.
Exactly. Yeah.
Okay.
Very.
Okay. So it was absolutely fantastic. Thanks for this very interesting part dedicated to the upper face, orbit, temple, and forehead.
Yes.
I'm Else Marie Lissauer from Denmark. I've been injecting since 1969, and I think we should be aware we inject in the temple area because there's a deep artery located directly at the bone. So if we inject in the muscle with a sharp needle, we have to aspirate. I have made a video, you can see it on YouTube. I've shown which product can we aspirate in which needles.
Listen. Aspiration issue is not completely clarified. Did you ever try to aspirate from a tube or from the container with 30-gauge needle?
Yes.
Blood, is it possible?
I used blue ink, not blood.
But because there are claims now, people have tried it, that it's impossible to aspirate blood through the 30-gauge needle. You can do it with bigger needles. I don't really think that we have a complete answer to that.
No.
Aspirate, it will never damage, but it might be giving you a false confidence.